children, he enjoys being outdoors and loves spending time with his family. Help me welcome Dr. Clyde and Alicia.
Yeah, thank you so much everybody for coming. There may be times when I don't use this mic, but I'll try not to. I mean, I use it all the time. But so Alicia and I are so happy for you to come here. Whether you have diabetes yourself, or maybe you have a family member or a close friend that has diabetes, we're just glad to be here. So Alicia and I are, we've only been here relatively a short time, but even in the short time we've been here, we're aware that Douglas County, like the rest of the United States, has a problem with diabetes. Okay, it's a big problem throughout the nation, and so we're here tonight to, as healthcare providers, we like to see where we can make a difference, and so we thought that maybe talking with some of the community members here in Roseburg, we could make a difference with diabetes. We understand, tonight we'll be talking in pretty broad terms about, what is diabetes and probably how to prevent it and try to fix it. But we understand that diabetes can be a very individual experience for, so for some people it's a few lifestyle changes, a little bit of exercise, maybe taking one pill a day. But for other people it can be, a very devastating problem in their lives and really life-changing. So, but despite that, we know it's a serious topic. We want to keep tonight very positive and lighthearted, and we want to learn with you and share with you and have a little bit of fun and enjoy each other's time while we're here this evening. So what we're going to be covering, obviously, is in addition to type 2 diabetes, we'll be covering the problems of, we'll find out what insulin resistance is, what pre-diabetes is. Some people might wonder should that word even exist, pre-diabetes. And then obviously we'll be discussing prevention and some simple ways to, well, not necessarily simple, but some straightforward ways to manage diabetes and help prevent it.
Okay, again, thank you everybody for coming tonight. We really appreciate you being here and spending your time with us this evening. Just speaking in very broad terms, we're going to start out with what is diabetes. A lot of people are familiar with the fact that diabetes is linked to something having to do with too much sugar in the body. And we're going to go more into detail about this in a little bit, but the main thing that I want to emphasize here is it's also an insulin problem. So your body's either not making enough insulin or not using insulin in the way that it should. And again, in a few minutes, we're going to get into a lot more detail about what insulin resistance actually is and what it means for, how you can manage your diabetes better.
And again, as you all know, diabetes is really common. So 30 million Americans have diabetes, and an even greater number have pre-diabetes. Again, we'll talk more about what that is, but obviously there are people that maybe are on the road to getting full-blown diabetes. I think last year, 2015, the United States spent like $330 billion on diabetes, managing it. So obviously I think that's up like 25% in the last 5 years. So it's something that we're hoping to, turn the corner on one of these days. So, a picture's worth 1,000 words, right? So just another perspective on diabetes. So with type 2 diabetes, a big component of type 2, as opposed to type 1, and we'll talk about that, is being overweight or being obese. Obesity and type 2 diabetes are just very, very closely related. So understanding what's going on with obesity in the United States will help us understand type 2 diabetes. As you can see here, and here's Oregon. So in 1994, and then orange. So they define obesity. I think most of us we have a good feeling what that is. But in Oregon at that time, there was like 15% of the people in Oregon were obese 20 years ago. So now, in 2015, see over there on the far right, you can see the dark red states. That means that now over 26% of people are obese in those dark red states, including Oregon. So this is, now the bottom side here is what's happened with diabetes over the last 20 years. In Oregon in 1994, there was about less than 4% of people had diabetes. And then now it's, in the last 20 years, that prevalence or the number of people with diabetes has doubled. Now it's over 9% people with diabetes in Oregon. And that's, again, this doesn't include pre-diabetes or people on the road to diabetes. So it's, you guys get the picture? So, you know, it's obviously a serious disease. It's unfortunately something that can be managed, so we're going to talk about that. And of course, you know, why do we want to treat, why do we care about treating diabetes? You know, what's wrong with having a high blood sugar? Well, as you know, and Alicia will talk more later, you know, it causes, most common cause of blindness in the United States, one of the most common causes of kidney failure, you know, heart attacks, amputations, and we'll talk about that some more. So that's, you know, the big picture, that's why we're here. So one other thing, so this talk tonight isn't so much for people with type 1 diabetes, to be honest with you. The type 2 is much more common, so nothing against people here with type 1 diabetes, obviously that's very important too. But what's interesting between the two types of diabetes, and there's probably more than just two types, but that's how we like to categorize them, but both of them, whether it's type 1 or type 2, they have this genetic or familial component to them that plays a big role, whether you're going to get diabetes or not. And they also both have an environmental component to it. And we don't understand this very well, particularly for type 1 diabetes, but we know it's there. And, you know, so for type 1 diabetes, just to understand, that's the big problem with, hey, you don't have enough insulin, you're insulin deficient, and that's your classic, you know, young person developing diabetes in, you know, in high school or grade school. Whereas with type 2, there's also a huge familial component to it, but fortunately, and there's a big environmental component to it as well, which is what we're talking about. But fortunately, as opposed to the environmental component of type 1, which we don't understand, with type 2 diabetes, we understand a lot about the environmental component. I'm talking about, you know, what we eat and drink and what we do with our physical activity, but fortunately, there is a lot we can do to change that environment as far as developing type 2 diabetes.
Okay, so I'm about to explain what I think is a really difficult concept. So get ready to go on this journey with me. I will probably use a lot of hand gestures. So basically, we got to start back with insulin. So what is insulin? So insulin is a hormone made by an organ in your body called the pancreas. Pancreas is a little organ that hangs out behind your stomach. In producing insulin is only one of the jobs of the pancreas, but for the sake of tonight's, you know, explanation, let's just stick with that. So insulin has a really important job, and that job is to help stabilize your blood sugar levels or your glucose levels. So glucose, which is in the picture here is those little red dots. Glucose is one form of energy that your body uses. So, you know, your body can take the sugar and make it into energy that your body can use. Now, how does it do that? So, if the sugar is just floating around out there in your bloodstream, your body can't use it for energy. So if you think about the sugar being out here somewhere, okay, your body can't utilize it for energy when it's out there. So what it needs to do is it needs to move it into the body tissues or the cells, okay? So in this picture, the insulin is like a key, like a house key, okay? And the cell is like a little house with a tiny locked door. So insulin's job is to go in, unlock the door, and move sugar inside so that the body can use it. So our bodies are very, very good at doing this, and a lot of times do this for a number of years without any issue. So one of the problems that happens in type 2 diabetes is something happens to the key. So something happens to the insulin. And for whatever reason, the insulin key is unable to go ahead and open that door and move the sugar back inside the cell. So as a result, the sugar builds up in the bloodstream and accumulates, which means we have too high sugar, and thus we develop diabetes. So basically, the point here is what do these defective keys mean? and these are insulin resistance. So in type 2 diabetes, it's not necessarily that your body doesn't make insulin, especially in the beginning, it just makes insulin that the body can't use. So as a result of not being able to use this insulin very well, we develop insulin resistance. Now insulin resistance actually happens years before diabetes happens, and you don't have any symptoms, you feel fine, because your body's still doing its job, it just is taking a lot more work to do it, okay? So the problem with insulin resistance is it predisposes us to diabetes. So it comes before diabetes, it comes even before pre-diabetes, and it really increases your risk of heart disease. You may have heard of people with diabetes having like heart attacks and strokes and things like that, and it's because there's a link between the two. So I just want you to link in your mind this insulin resistance problem with the diabetes. So basically, this is just a comparison between type 1 and type 2. Like Dr. Clyde said, we're not going to talk a lot about type 1 tonight, but I want you to understand the fundamental difference or the primary difference between type 1 and type 2. So if we think of insulin like the key, okay, the picture on the left, type 1 diabetes, you have all this sugar floating around, but no keys to unlock the door and let the sugar into the cell. So these people need insulin from the time that they're diagnosed, basically. On the other hand, with the type 2 diabetes, again, we have the insulin keys, they're just faulty or not working well. So that leads us to this kind of vicious cycle, okay? So what is the fundamental problem of diabetes, okay? It's this cycle here. So what happens is we have this insulin resistance problem. And because we're insulin resistant, our sugar's higher. It makes our sugar rise and rise. So as a result, our body tries to compensate by giving us more insulin. Or if we inject insulin, we have to take more insulin. As a result, insulin makes us hungry, and insulin makes us store fat, so insulin makes us put on weight. And then also, if your sugars are high, you're going to be really tired, and you're going to be feeling sluggish and lethargic. And as a result, sometimes if we're feeling hungry or tired, we crave things that are not necessarily the best food choices. So we're craving things that are really high in carbohydrate or sweet. So then, what happens next? If we're eating things that are high in carbohydrate or really sweet, our sugar is going to rise some more. So you see how we're developing this kind of circular problem here that just feeds on itself. So the higher our sugars are, the more insulin requirement that we have, the more that we're storing fat, the more our sugars are rising, the more insulin we need. So it just keeps going around and around.
So, Lise just talked a lot about insulin resistance and pre-diabetes. So what we wanted to show you here is a common skin issue that comes up with insulin resistance. So if you know someone yourself or someone close to you or a family member who has this, dark rash on the back of the neck, it's not because they have a dirty neck and need to go take a shower. It's because they actually have, this is a sign of severe insulin resistance and pre-diabetes. So. And you can also get this rash sometimes in the back of your knuckles or in your armpits, other parts of your body that we call extensor surfaces. But the point is that this slide is, again, another sign of insulin resistance on the road to diabetes and a sign of pre-diabetes. So again, what is pre-diabetes? I think it makes sense to you understand that better. First of all, what are normal sugars? So one way to define a normal blood sugar is to measure blood sugar in the fasting state, so in the morning before you've eaten or drink anything. So normal sugar is less than 99 or less. That's normal. That's easy to understand. Now, then as your sugars become abnormal, the cutoff of what defines diabetes is somewhat arbitrary, but what it is it's 126 or greater. So if your sugar is 126 or greater, we define that as diabetes mellitus, okay? So everything between there, between 100 and 126, that's just pre-diabetes, okay? So if you have a better word for that condition, let me know afterwards. Now another way to diagnose diabetes is with a common blood test called an A1C. The nice thing about this test is you don't have to do it in the fasting state. You can draw this blood test at any time during the day. And the A1C reflects your average sugar over the previous 2 to 3 months. So it's really nice, you know, the sugar that you get in the morning or sometime in the day, it's just that point in time what your sugar is. The A1C tells what your sugar was over the previous 2 to 3 months. For example, if you had an A1C, well, let me define the numbers here first. So for diabetes, the number happens to be 6.5 or greater. That's equals, you know, the diagnosis of diabetes. If it's down in the lower 5s, that's normal. But anything below 6.5 and normal, though, we call that again, you know, pre-diabetes. So for example, if you had an A1C of 7.0, so a little above, you know, the cutoff of 6.5, if you had an A1C of 7, that means for the previous 2 months, your sugars have been averaging around 150. And that's not just and that incorporates not just the fasting sugar in the morning when it's usually lower, but also the sugars when they go high after you eat, you know, after meals, the sugars go high. So A1C, it's real important to understand that, and talking to your provider about what you all think you'd like your A1C to be. Because every individual, you know, you may have a different target for what you want your A1C to be. So again, a nice thing about this A1C for a lot of people here, when we're talking about prevention of cardiovascular problems, is that you can find out not only if you have diabetes, but if you have pre-diabetes. And because if you have pre-diabetes or an A1C in the low 6s, upper 5s, then maybe you're on the road to something worse. Yeah.
Okay, so why would having better blood sugar matter? You know, a lot of times people tell me that they feel fine when their blood sugar is higher. Most of the time people don't even notice that they have a blood sugar that's higher until it's really, really high. So where's the incentive here? People with better blood sugars are less likely to develop the complications of diabetes. And you know, those people who have better blood sugars are less likely to have a heart attack. They're less likely to end up on dialysis because of kidney failure. You know, less likely to lose fingers and toes and limbs due to nerve damage and damage to the blood vessels. Also important, you know, less likely to suffer from sexual dysfunction. I know we've all seen lots of Cialis commercials. And gum disease and tooth decay. A lot of people don't realize how linked diabetes is with problems with your teeth and gums. So if you don't see a dentist regularly, if you are diabetic, you are at higher risk of having some problems with gum disease and things like that. So I want to talk a little bit about risk factors. The main thing that I want to emphasize with the risk factors is the things that we can change versus the things that we don't have much control over, okay? So the things that we don't have much control over are called non-modifiable risk factors. Those are basically our age. So as we get older, you're at higher risk for diabetes. Certain ethnic groups are more at risk. And then a really important link is having family members with diabetes. So if you have a first-degree relative, so a mom, a dad, sister, brother, who has diabetes, you're actually 5 to 10 times more likely to develop diabetes yourself. So if there's somebody in your house with diabetes, you know, even if you don't have it, you're automatically at risk for it because of that relation. Also, being pregnant and having diabetes is a risk factor too. So those are the ones we don't have any control over. Good, we can put those to the side. Now, what about the stuff that we do have control over? What can we change? So we can change our weight. You know, if we're overweight, especially significantly overweight, even losing a small percentage of your body weight, 5 to 10%, actually has a tremendous benefit for your blood sugars and, you know, for really a whole host of other risk factors for other diseases as well. The other thing I want to emphasize is if you take medications for high blood pressure or high cholesterol, it doesn't necessarily mean that you're not still at risk, okay? We want to make sure that your blood pressure and your cholesterol are well controlled on those medications. So when your doctor prescribes you medications for blood pressure and cholesterol, we actually have certain targets or goals that we're trying to meet. So for those particular goal points, if you're not there, even if you're taking blood pressure pills and cholesterol pills, we may need to modify your treatment, add more medications, or do something different with the diet or exercise to help get you where you need to be. And of course, having prediabetes. So having prediabetes is absolutely something that you can reverse. It doesn't have to progress to diabetes. And a couple more things we can change. I like that there's double the amount of things that we can do over the things that we can't do. How much we move our bodies, okay? Some people have certain physical limitations. They can't move their bodies as much as they would like, but it doesn't mean that there aren't other things or modifications that they can make to be able to do something. Also, if you're a smoker, you know, not just for diabetes, but a whole other host of cardiovascular risk, colon cancer, all those things, you gotta quit. And then, interestingly enough, and this is one that I don't think it's emphasized enough, is chronic stress. So people who are under chronically, you know, they have really stressful jobs, or they have a lot going on in their lives, or they're a caregiver for someone, and they're chronically, constantly feeling very stressed and overwhelmed. If you're not coping effectively with that, if you're not getting the support and the help that you need, the hormones that your body releases when you're stressed raise your blood sugars. Same thing happens when you're not sleeping well. So those hormones that are released when you have poor sleep quality, those also raise your blood sugars. So managing our stress well and sleeping well, you know, help prevent complications and also improve your sugars. The last two, they're kind of a combination of some of the other problems that we had talked about, as well as PCOS, which happens in women. It's related to insulin resistance. So, how do I know if I'm getting diabetes? So, I can't tell you how many times people will come into the office and we'll have our conversation the first time we meet, and I'll say, you know, when did you get diagnosed with diabetes? And if they have a date, you know, well, how did you know you crossed that line? What happened? Was it just a routine blood test that your doctor did, or were you feeling sick? You know, sometimes people will present, especially if they have really high blood sugars, they'll come in with classic symptoms as they're peeing a ton, they're wanting to drink a ton, you know, they feel like crap, they're tired all the time. They tell me I just didn't feel right. And then they go in and lo and behold, their sugar is sky high. But a lot of people don't experience that. They say, I was just going about my business, I was feeling just fine. Something else happened, and then all of a sudden, I'm bombarded with the fact that I have diabetes. So people will say, you know, I had a heart attack, or I had a stroke, or I had a minor surgery, and somebody did a lab, and I found out I had diabetes. And the point is, it doesn't just happen overnight. It's not like a switch gets flipped. This is something that happens over time. It develops gradually over years and years and years. Like we were saying back in the beginning, you know, when I was explaining insulin resistance, the insulin resistance comes first, and then it's prediabetes, and then it's diabetes, okay? So we just talked about a lot of stuff. I think that in all of that, you know, probably making a little checklist in your brain, okay, what risk factors do I have? So how many risk factors did you find? And more importantly, what can we do about the risk factors that we identified?
So there's just a few more minutes of Alicia and I talking, so I just want to remind you that at the end here we're going to take questions from the audience. So if you have cards or somewhere to write down your questions, please start thinking about that while we're talking here. So this is an important slide. Probably a bit too many bullets on here, but you know, this is what it's all about. Is, you know, what can you do to prevent or treat your diabetes? Obviously, you know, what you eat plays a big part in managing diabetes. So, you know, what you eat, how much you eat, and to some extent even, you know, when you eat can make a difference in controlling your blood, in preventing weight gain and controlling blood sugars. Physical activity, extremely important. We've talked a lot about, you know, insulin resistance. Physical activity is one of the best ways to lower and improve your insulin resistance. So a lot of diabetes is about eating less and moving more, and if you can do both, you know, that's even better. There's only one medication I'm going to mention by name tonight, because obviously we're both experts at prescribing lots of medications, but that's not our emphasis tonight. But I just want to mention one, Metformin. it's kind of an oldie but a goodie. You may hear some bad press on the internet or on the news, but metformin is still an excellent medication. It's inexpensive, it's very safe, and it's very effective. So, if you have type 2 diabetes, if at all possible, this is the one medication that most everybody wants to be on.
So also, self-monitoring. So if you don't know what your numbers are, a lot of times people will tell me, I know what it's going to be, that's why I didn't check it. And I try not to demonize blood sugars. I want you to use that kind of stuff as objective data. These are data points. This is telling me something. So checking your blood sugars, really important, and bringing your blood sugars to your doctors and reviewing them together. Because like Dr. Clyde said earlier with the A1C and just, if you're checking your blood sugar just once in the morning, it's like a Polaroid picture, okay? It's a moment in time, it doesn't tell the whole story. So it's good to try and get an idea of what's going on. Checking your blood pressure at home, very important, especially if you're taking medications for your blood pressure. And then also keeping an eye on your weight, and then if you're diabetic, your feet are so important, especially if you suffer from neuropathy, which is nerve damage to the feet, causes numbness, tingling, burning, shooting pains. If you have decreased sensation in your feet, you're at increased risk of injury, because obviously if you step on something, you're not going to feel it. So making sure you're checking your feet, keeping a close eye on your skin. I can't overemphasize enough how important all your preventative health care is. So all the things that you would normally do anyway. So going to the eye doctor, going to the dentist, getting your flu and your pneumonia vaccines, going to see your doctor for your annual physical. All of those things are really important in the big picture. And then lastly, I kind of touched on this a little bit when I was talking about chronic stress. So you really have to learn to problem solve. Diabetes is a chronic illness. A lot of people, their motivation waxes and wanes because they get sick of it, This is something you do day in and day out for years and years and years, and at times you're just over it. And so you really have to learn how to problem solve, to work on managing your stress in an effective way, not with our friends Ben and Jerry. Making sure and making sure we're getting support from other people. Sometimes people have a really hard time asking for the help they need. They're embarrassed. They don't want to burden others. Most people really are more than happy to help you if you just say, hey, it'd be really great if you could help me with this. Or, not bring the 16-layer cake to Christmas. That'd be great.
So we all wish it was this simple, just lose weight and make your sugars better, but we know it's not. But what I will say about this is, a lot of different diets out there, whether it's a low-carb diet, a low-fat diet, a plant-based diet, the South Beach diet, Mediterranean diet, alternate day fasting diet. The truth is, these diets have all been compared. We really don't know which one's the best for losing weight. So, I kind of tell people, find the one that works best for you and helps you lose weight, and that's the one that I think you should do. But there are a few things among all these diets that seem to work. There are some things that are in common, and I'm going to see how well you guys know what the best diets are. Okay, so I got a little quiz for you. It's a multiple choice, A, B, C. So you have to pick which one of these healthy plates. So this is choice A, okay? All right, this is choice A. This is choice B. And this is choice C. So I hope all of you realize that the true healthy plate was choice A. And like I said, I don't have a favorite diet, but I think something like the Mediterranean diet, where you're focusing on a lot of non-starchy vegetables and fruits and lean protein. That's whole grains, things like that. That's somewhere in there. That's close to the optimal diet, but I really can't say what it is.
But making changes is so hard. How you can do a diet for a little while, you lose weight, something happens, life happens, gain it back. It's hard to sustain these things. Almost every challenge in life, almost every barrier has some type of solution. Some of it depends on the way you look at it, some of it depends on what your resources are, but usually there's something you can do about most things. And if you can't, there's no use worrying about them anyway. And it's never too late to try a new thing. It doesn't matter how old you are, if you've been diabetic for 2 days or 35 years. You can always try something different, you can always make a change. I know I already said this, but I'm going to say it again. Learning to ask for the support that you need. You don't have to do this by yourself, okay? There's a whole team of people around you, and it's good that you feel you can come to your doctor and talk to your doctor about your diabetes, but you should also feel like you can talk to your friends and family about it too. Because they're there with you every day. We can't come home with you. And also recognizing depression symptoms and something called diabetes distress. So just show of hands, has anybody ever heard of diabetes distress? Okay, that's why I want to talk about it. So diabetes distress, very similar symptoms to depression. And it's a kind of related to what I talked about earlier about that waxing and waning motivation. You get just real burnt out on having this chronic illness. And it can make you, just not care. Some people just quit taking their medications, and people, they just don't want to check their sugars anymore. It's important to tease out or identify if that is depression or diabetes distress. Were we going to save the questions for the end, or did you want me to address that now?
I was wondering if diabetes burnout is the same.
Yes, exactly. Yes.
Okay.
So diabetes burnout, that's a great question. I don't know if everybody heard it, but diabetes burnout and diabetes distress are the same thing, okay? So it's important to recognize if you have any symptoms, hopelessness, helplessness, powerlessness, sleeping too much, eating too much, all those similar depression symptoms. If you're experiencing that stuff, talk to your doctor. So ultimately, we want you to take control. It's really, really important that you understand how much of this is in your hands. Tonight, and when Dr. Clyde and I were putting this presentation together, we chose intentionally not to emphasize the medications. We know that people with diabetes, a lot of people do take medications, need medications, but I wanted to really, really spend a lot of time talking about the stuff that to me is just as important, if not more important than the medications. And that's the kind of stuff that you can do at home, with the foods that you eat, and just generally taking care of yourself, general wellness, and those things are really the most important things in my mind.
So, like I said, we want to emphasize medication, but obviously it's a reality. A lot of us take medications for diabetes, and I wanted to make a few comments, general comments about one way to look at all of our diabetes medications out there. I mean, unfortunately, a lot of the older ones, the insulin, the glipizide, glimepiride, a lot of the sulfonylureas, they help improve your sugars, but unfortunately they have some side effects that most of them they cause weight gain, and they can cause hypoglycemia, making your sugars go low. But as you may know, your insurance company loves you to take these older medications because they're very inexpensive. Okay, and sometimes a lot of them you're kind of getting what you pay for. The only exception to this, again, is the Metformin that I brought up earlier. I think that's a great, very cost-effective medication. Now, some of the newer medications I think are great. They don't cause the weight gain. Many of them cause weight loss, and they don't cause hypoglycemia. But the challenge is they cost a lot of money, and sometimes they're very challenging to get insurance to help you pay for them. So, if you need medications and you're trying to get some of the better medications, remember that being compliant with the medications that your provider is prescribing to you, being meticulously compliant, is critical to being able to get maybe some of the better medications down the road. If you're seeing your doctor and he tells you to start taking a lower dose of your insulin, for example, but your prescription says you should be picking it up every month, but your doctor says, no, I don't want you taking exactly that much insulin, taking you that much insulin, as it says on the bottle, you still need to go to the pharmacy and pick up that medication every single month. I don't care if it's piling up at home in your cupboard. You got to pick up those medications, be compliant with them, or your insurance is not going to help you get the better medications. That's just an unfortunate reality. But if you're not sure about your medications or what are the good ones, what are the side effects, please talk to your provider about that. So fortunately, most people with diabetes do not need to come see somebody who's a specialist in diabetes. A lot of this that's our point here, is you can manage this on your own. you know, there are times when you need to come see a specialist. You know, if you're having to go to the emergency room or the hospital, you know, there's times when you need help from a diabetes specialist, having very high sugars or very low sugars. Your A1C is like 10, 11, 12, you probably need to see a specialist. But again, you know, just remember that, you know, the lifestyle changes you can make are better than any medication or drug out there for your diabetes.
So this last slide, I actually am not going to read out loud to you. I wanted you guys to just take a moment to read it. We appreciate you so much being here tonight, and you know, the take-home message is right here.
So this is our last slide. Then we're going to start taking questions. Okay, so I want you to be aware that the Community Cancer Center does have a, you know, a lot of these resources in the community. You can talk to your provider who you see, and they can give you some other places to other opportunities or ideas about getting support here in the community. But on June 5th, there's a Living Well with Diabetes, and they meet you know, the first Tuesday of the month. And then also, you know, here in town in Roseburg in the last several months, there's a new, completely unrelated to, you know, well, it wasn't something that obviously that us as health providers were planning for or knew anything about initially. But anyway, the Blue Zones Community Project, just promoting healthy living and enjoying life, you know, that also, I think their philosophy is very in line with, you know, treating and preventing diabetes as well. So Blue Zones is it's a grant, a state grant given to, you know, Roseburg was, or Umpqua, Douglas County was chosen out of, you know, thousands of cities in the United States. It was chosen and given some free money here to come help us improve our community, better living, better lifestyles. And so if you hear about the Blue Zones, whether it's on Facebook or they have a location in downtown Roseburg, check it out. You might find you like what some of their ideas. I think that's for. I think we're about ready for questions.
So this is just a reminder for our next topic. We are so lucky to have a new person working with us at Evergreen, Dawn Brumfeld. She's a behavioral health specialist, has so much experience in mental health and substance abuse and all sorts of different things. And she's actually going to do our next topic on emotional health and wellness. So effective strategies for managing your life's challenges. And that's going to be August 30th at 5:30. And again, if you want to sign up, I think you could probably contact Lindsay, or is there a sign-up sheet as well?
It'll be the same contact.
Okay, so same contact information as tonight.
So Alicia and I are consulting here. I'm going to do this question.
Okay, great. Yeah, I'll look at these.
So one of the questions was, you know, I've heard metformin is really dangerous. I can assure you metformin is not really dangerous. In fact, since I've been back in Roseburg, I have lots of people that were taken off of it many years ago for whatever reason, and I've put them back on it. All right, and so talk to your provider about it. You know, there are definitely patients that shouldn't take it. Those who are like on dialysis and, you know, severe, you know, kidney disease in particular, but metformin is generally very, compared to, you know, look at the broad scope of medications out there in the world, metformin is very safe.
So interestingly, tagging on to that metformin question, someone had asked, is there any value in taking metformin preventatively? So actually, we already do that in a lot of cases. Metformin is prescribed to women with PCOS, which is polycystic ovarian syndrome, insulin resistance related. And then also we do prescribe metformin to people with prediabetes. We also generally tag on to that the lifestyle changes as well. But yes is the answer to that question.
So this question is, when is the best time to check your sugars in your blood sugar? That's a very good question. Now, some people with like pre-diabetes or even diabetes, if all you're taking is metformin, don't actually need to check their sugars every day, but a lot of people need to check it, you know, several times a day. So So what is the best strategy for checking sugars? So I think we've all heard, checking them first thing in the morning, can be helpful to get an idea of just in general, how your sugars are trending. But there's another way of checking sugars that's relatively new out there. Actually, I had a slide for it. So I call it, or people call it, paired glucose testing. So I get a lot of questions from patients, how much will this food raise my sugar, or how much will that food raise my sugar? How do I know if the food raises my sugar? And honestly, I don't always know the answer, but I'll tell them, well, why don't you find out how much it raises your sugar? So what I mean by paired glucose testing is you check your sugar. It means checking your sugar before your meal, before you eat your meal, and then about 1 to 2 hours after you eat, check your sugar again, and see how much that particular food makes your sugar go up. If it's making your sugar go from 120 to 220, then there's something that needs to be changed there, whether it's eating less of that type of food or not eating that food. Another important way to check, to learn from checking sugars at home on your own is around exercise. Some people can be surprised how much exercise can lower their sugars. So you can check your sugar like before going for a walk, and then go for a brisk walk, and then about an hour later check your sugar again, and you might be surprised how much it brings your sugar down. Maybe it'll be 160 before the walk, and then afterwards it'll come down to 120, for example. So I think paired glucose testing is something that you're not going to do it with every meal, but pick 2 or 3 meals during the week and and check your sugars before and 1 to 2 hours after the meal. That's a good time to check sugars with someone with type 2 diabetes. And then if you're on some long-acting medications, particularly like insulin, taking insulin in the morning or insulin at bedtime, comparing your bedtime sugar with your morning sugar is really helpful. You want to know how much your sugar's dropping overnight. If you're going to bed with a sugar of 180 and you're waking up at 70 the next morning, you're getting too much insulin if it's dropping that much during the night. So I generally tell patients, if it's dropping 50 to 100 points every night, you're probably on too much insulin, for example. So don't just check it before every meal and at bedtime, 4 times a day. You want to, maybe check it at bedtime and in the morning occasionally, and then checking it, before and after meals on occasion. Thinking more of it that way, as opposed to just a routine of doing it, 3 or 4 times a day and not thinking about what you're doing with those numbers.
So I have several questions about supplements. So I'm going to kind of answer this in umbrella terms, and Dr. Clyde, feel free to add on to this if you'd like to. So a lot of people take supplements for their diabetes. Some of them are just vitamin supplements, in which case I don't think there's a lot of harm in anything like cinnamon or turmeric or chromium or any of those. You just need to make sure that they're good quality, because you don't always know, where the vitamins are coming from. However, there are supplements that people take for their diabetes that we can't necessarily recommend. And the reason for that is the people who pay to do research studies on these medications don't have a lot of interest in supplements, because supplements aren't really going to make them any money. And that's just the reality of it. So a lot of these supplements, do they work? Probably yes. They're probably effective, but do we have enough good, solid scientific evidence out there that tells us how much to give and what medications they interact with? And the answer is no. I do have people who have told me they take berberine complex, which is an old Chinese supplement, and yes, it does lower your blood sugar, but there's no safety studies, so we don't know how it interacts with your other diabetes medications. And this particular patient was actually having a lot of low blood sugars, so we had a conversation about stopping the berberine, and that actually fixed the low blood sugars. So when in doubt, ask your doctor. I think that the supplements question is really difficult, because ideally if people can avoid medications, they want to, and I completely understand that. But we need to make sure that they're safe. It's not always easy to tell which ones are safe and in what dose.
Yeah, I think it's hard for us to keep up on all the different supplements out there and be experts on them. And I usually recommend FDA approved medications, because I can be more sure about the safety of them. And I just recommend if you're taking supplements, just make sure you're not spending too much money on them. They can get real expensive too. But usually we aren't able to give really good advice on all the different supplements. So this next question was, how do you know when you need to start insulin? So it's not a straightforward answer for everybody. It depends on, obviously the higher your sugar is, the more likely it is that you're going to need insulin. Sometimes it comes down to cost, unfortunately. Some of the insulins are very inexpensive, so because there are medications out there other than insulin that do very well with high sugars that normally used to start insulin with in the past. So, but generally, if your sugar is, if your A1C is getting up around, over 9, 10, then you're someone that's probably needs to start insulin. Or if your sugar when you check in the morning is, up around in the 200s, or certainly near the 300s, then you're someone who probably needs to be on insulin. So obviously something you need to talk to your provider about. But in general, if you're getting the upper 200s or 300s, at least in the short term, you might need to go on insulin. There's something out there called glucose toxicity, where just the high sugars themselves kind of lead to more insulin resistance and interfere with your body's ability to make insulin. So a lot of people just need to be on insulin temporarily. So this actually brings up a good topic that a lot of people have a big fear of going on insulin. They think once they're on it, they're stuck on it for life, and it causes heart attacks and amputations. I mean, it actually doesn't. Sometimes it's a very important short-term measure to get your sugars down into near the normal range, and then you're often able to come off of it after several months.
So I just got the golden question here. How many times a day do you recommend eating with diabetes? Snacks, question mark. This is a very hard question to answer, so I will do my best. Historically, I think that we've told people with diabetes to eat too often. So what I'm saying, I want to put a little if-but statement after it. As a general rule, it is a good idea to not snack. So if you can just stick with your 3 square meals, that's good. Also, we talk a lot to our patients about trying to leave a good gap of time between your dinner and your breakfast, at least 12 hours, sometimes a little bit more. So that period of time where you're not eating anything actually is very good for insulin resistance. So as far as the snacking and timing of food and everything, a lot of that depends actually on what medications you're on. So if your medications are dosed correctly, if you're on the right combination of medications, you shouldn't have to eat for fear of low blood sugar, ever. However, there are some medications that people are put on that if you don't eat regular meals or routine meals, or if you don't eat, for 4 or 5 hours, you do actually have the risk of a low blood sugar. Those are some of the older diabetes medications like glipizide, glimepiride, Amaryl. So yes, try not to snack. Try to only eat 3 meals a day, or even 2 meals a day if you want to. Not everybody eats 3 meals a day. And then trying to leave that big gap of time between dinner and breakfast. Do you want to look at any more of these? And there was also a question about the keto diet. So I'm not going to recommend specifically any one diet over another. People who aren't familiar with the ketogenic diet, it's a very low carbohydrate, moderate protein, and healthy fat diet. So I would say that it's fairly similar to a low carbohydrate diet or the Mediterranean diet without the bread. I think it's a good diet for diabetes because it's low in carbohydrate. And of course, carbohydrate is what raises your blood sugar the most out of fat, protein, and carbohydrate. But I'm not going to say that it's the best for you over. Basically, what it comes down to is you have to choose what you can stick with. The whole point of the whole dietary interventions is if it's something that you feel is too restrictive or too strict, and you don't think you can do it in the long term, then it's probably not a good choice for you.
Here's a question that talks about what about the role of protein in managing blood sugar. So there's 3 main groups of foods we eat. I think most of them know fat, protein, carbohydrates, and the ones that raise the sugar the most, but are still necessary to live is carbohydrates. So a lot of times people will go on a lower carb diet, and you kind of a related question patients are always asking, what's the ideal amount of carbs should I eat every day? And I think we used to give pretty set answers about, okay, this is how many carbs you need to eat, every meal 3 times a day. But I really think that that's changed over the years, and we don't know what the best amount of carbohydrates everybody, there isn't a fixed amount, I should say, for it's the same for everybody. Even when, for example, even when women get pregnant, generally we recommend so they can manage their sugars better, we recommend a lower carb diet, and certainly we wouldn't be recommending unhealthy diets to pregnant women. But eating protein, a little higher percentage of protein does make it easier to control your sugars. So I certainly don't recommend a high carb diet for people with diabetes, because that makes it more challenging to control your sugars. But a low carb diet may be a good option for some people. And you really would need to talk to your provider or nutritionist about what that means and what's a safe way to do that. There's plenty of books out there about it too if you want to read about low carb diets. But one shoe doesn't fit all. Yeah. Anything else?
I think there's. So somebody had asked me to explain again the symptoms of diabetes distress. So those would overlap very closely with depression symptoms. So that could be changes in mood, not having interest in things that you once enjoyed, sleeping too much or too little, eating too much or too little, feeling sad or feeling like it'd be better, basically pretending that your diabetes doesn't exist or not wanting to deal with it. So that's something that you definitely want to address if you feel like that's something that would match what's happening in your life. It's definitely something you can manage either through medication or talking to a counselor or talking to your provider. But it's a very real problem that affects people not just with diabetes, but with a lot of different illnesses that are long-term illnesses. I think that was most of the questions. We have a minute or two? Yeah. I think I'll take her first and then you can.
Have you ever heard, I just read recently that Brad's apple cider vinegar can lower your blood sugar?
So I've read some interesting stuff to that effect. Scientifically, I don't know how much research is out there on it, but yes, I have read that that fermented foods, apple cider vinegar and other fermented foods, when taken with carbohydrates, actually can help with sugars. I can't say off the top of my head how much scientific research there is behind that, but I have read about that.
Like if you ate pasta that wasn't whole grain or rice, so you could take 2 teaspoons in 1 ounce glass of water, and it will lower the effect of the carbohydrates.
Right, so yeah, I've read something similar. I don't know quantifiably, so quantity-wise, I don't know if how much taking the vinegar is going to help block the effects of the pasta.
I guess it won't hurt you.
I don't think it will hurt you, no. And you had a question?
Well, I do. Can you take oral meds forever as long as you keep your A1C in control and not damage yourself?
So very individualized, but yes, in some cases, people do stay on pills for 30, 40 years, Not everyone progresses to insulin. In saying that, and we had a slide on pancreatic beta cell destruction. Mm-hmm. So basically how over time your pancreas can't make insulin anymore. But that's so different in different people. So if someone ends up on insulin after 5 years, somebody else may not ever end up on insulin, and other people it can take 20, 30 years. It's very, very individualized.
But it won't destroy you.
Right. There's no long-term adverse side effects as far as we know of taking any of the medications that are prescribed to patients. I mean, I don't think you want to go on any medication and decide, okay, I'm going to be on this the rest of my life. It's it's a year-to-year thing. You see a provider on an annual basis, and you decide anew, do I still need to be on this? Maybe some new research will come out and say, oh, I should stop this or I should start that. So, I wouldn't make whatever you're on now doesn't necessarily mean that's what you're going to be on a year from now. Just take it, year by year.
I've been 30 years on pills, and every time he says the word insulin, I can do all those changes to get that A1C right back where it needs to be.
That's excellent, good job, that's
But I
great.
just wondered
Hands
if
off.
those pills are beating me up, that's what I guess I'm wondering.
Not that we're aware of,
Okay,
that's what we're aware of.
okay, then I'll do what I
We don't know everything, but we,
Can I take
Yeah.
one more? Okay, over here.
Is the main cause of glaucoma, is it caused from blood sugar problems?
So it can be dual. So there's more than one thing that causes glaucoma. So glaucoma is increased pressure in the eye. So having a high blood pressure actually can be a risk factor for glaucoma. But also, so when you think about complications of diabetes, everywhere that blood goes can be damaged. So the very tiny blood vessels in the eyes and all of the blood vessels around the eye can be damaged by the long-term high blood sugars damage the blood vessels. So it's a combination of high blood pressure and high blood sugar.
Can I follow up with another one?
all right, last question.
I do have neuropathy in my feet, and I've often thought a bicycle or something like this, because
Yeah.
when you're out walking, you're pounding the bottom.
I actually had a conversation with somebody about this today.
Yeah.
Actually, I think for neuropathy, bicycling is great because people with neuropathy tend to sometimes have some balance issues.
Right.
And the ground doesn't quite feel right. So if you're stationary and you know that you're safe and you're in a in a stationary position, bicycling, stationary bike or recumbent bike, excellent exercise for somebody with neuropathy.
Thank you.
Yeah, me and my parents are sitting back there. We're big bicycle fans, so. So Lisa and I are gonna stay up here. If you have other questions, you want to come up and ask us, on your own that you didn't want to hadn't answered, hadn't thought of. So, but thank you so much for coming. Very nice to meet you all.
Yeah. Well, we're doing it.
think.